The latest on that deadly coronavirus. The State Department raised the travel advisory for China to level 4. That means they are urging Americans to avoid all travel to China. And this comes after the State Department authorized the departure of non-emergency personnel and their families from embassies and consulates in China. The U.S. will also be staging additional evacuation flights from Wuhan for private U.S. citizens. The flights will take place on or about February 3rd. Interested U.S. citizens with valid passports should contact the State Department with the information that you see on your screen right there. Meanwhile, the World Health Organization declared the coronavirus outbreak a global health emergency. The WHO's Director General said the main reason for the declaration is not because of what is happening in China, but because of what could happen in other countries.
Our greatest concern is the potential for the virus to spread to countries with weaker health systems and which are ill prepared to deal with it.
WHO's Director General says the organization continues to have confidence in China's capacity to control the outbreak. More than 200 people have died in China from the illness. Nearly 10,000 have been infected worldwide, including 6 people right here in the U.S. And health officials confirm that the newest patient in Chicago got it from his wife. That is the first known person-to-person transmission confirmed here in the United States. So CBS This Morning lead national correspondent David Begnaud is outside of a hospital that is ready to treat patients suspected of having the virus. David, what have you learned so far?
Well, this is the Loma University Medical Center. They are a level 1 trauma center, the only one really in this area. And they're not very far from that Air Force base, or the reserve base actually, where more than 100 Americans arrived by flight about 48 hours ago. And they are being held on that base. They've been told it's voluntary, but actually somebody tried to leave yesterday and there was an order for them to stay on the base. So the hospital's not too far from that. And hospital officials say once they found out that plane was coming in here, they went ahead and activated their tent area outside. They've used this for flu in the past, flu outbreaks, but they're using it for coronavirus now. So when you come in, what they have are some chairs, the one bed here, they can bring in more, some cots, just a triage area. And Anne-Marie, one of the first things they do is take your temperature. Coronavirus symptoms are very similar to the flu: cough, fever, shortness of breath, those type of things. So Loma Linda is ready. This area is unique in that it actually, whatever's in here goes out and only fresh air comes in. So it's incubated, so to speak, safe area. They'd rather you come here if you have symptoms rather than go into the ER. So just one example of what a hospital is doing because they are so close to where those folks arrived from China.
Right. So I mentioned leading into you about this new case in Chicago where the gentleman got the virus from his wife. What do we know about that case?
Yeah. So here's what we know. She went to China in July. She came back. He got the illness from her. He did not travel to China. She is currently in the hospital. I'm sorry, what are you saying? Yeah, December. What did I say? July. Oh, July. I meant December. The wife went to China in December, came back, had the virus. The husband then got it from her. Both of them are hospitalized in Chicago. She is listed in very good condition. That's what the CDC said yesterday. He is also in the hospital. He's listed in stable condition. What the health officials in Illinois are doing right now is finding out if he went to any public areas, right? Was he around large groups of people? And do they need to contact those folks as well?
Yeah, that's the thing about this virus is that, you know, collectively around the world, we're all learning about what it's capable of sort of in the moment. And we know that the World Health Organization declared, you know, this to be sort of a public health emergency of international proportions. And that's part of the reason. I know sometimes people look at the numbers and they go, oh, so many people die of the flu than, you know, the coronavirus. But it's that we really don't know where this is going and what it's capable of.
So that's a good point. In fact, I was on the conference call yesterday with the CDC, and one of the questions asked to them is, can you detect coronavirus before someone starts showing symptoms? And the answer was, we don't know. There's a lot that officials don't know. So yes, contextually, when you put it in context, the flu is far more problematic, if you will, than coronavirus. However, there's a vaccine for the flu. There's a protocol. They're used to it. They do it regularly. This is something brand new. So even though we only have 6 cases in the United States, There was an entire conference call that the CDC had where members of the media were allowed to get on yesterday. And let me give you some context from there. They did not sound panicked at all. In fact, the head of the CDC and the number 2 was like, listen, we know what it is. We know where it's happening. We're in touch with every single health department. They all sounded very cogent and clear in the directives they were giving. And they also said the public does not need to wear masks as of right now. We are not advocating for that. We do not think the public should panic. We are monitoring everything very closely. And listen, that's a pretty extreme step that the U.S. State Department took in saying do not travel to China at all. For context, they have said in the past, restrict your, when it comes to SARS and other illnesses in the past. But that's a pretty stern warning, if you will. Don't go at all. But that's what they think is best right now, to just avoid trips to China.
All right, David, thank you so much.